5 years. This is Dr. P. Venkata Sudhakar, consultant spine surgeon, Medicover Hospitals, Vizag. Today I'll be speaking about a few myths associated with spine surgery, which people have in their mind before either consulting a spine surgeon or coming to undergo spine surgery. So the first myth which people tend to have is that if we undergo spine surgery, we will have to lie on the bed or we will have to be bedridden for a long time, which is wrong. Because here at Medicover Hospitals, what we do is that once the patient undergoes spine surgery, we make him walk the second or third day, depending upon the mobility status of the patient. So this myth is wrong totally, that you have to take bed rest for complete 2 or 3 months. Second myth associated with spine surgery is that you will land up in paralysis once you undergo spine surgery. That is a wrong notion, because today what we are doing here in spine surgery at Medicover Hospitals, the instruments which we are using are quite refined and sophisticated. So because of that, the complication rate, I agree that every surgery is associated with some complications. However, the complication rate associated with the spine surgeries nowadays is only around 1 to 2%. So this is again a wrong notion that you will land up in paralysis after undergoing spine surgery. Third myth which people have is that if you are referred to a spine surgeon by an ortho surgeon, you will have to undergo spine surgery, which is again wrong. Not all the disorders of spine require surgery. Some can be managed with the help of physiotherapy initially. However, if the disease progresses, or else if the patient does not get any relief further, then we will have to think about other modalities of treatment rather than jumping on first to surgery. Fourth myth which people have is that undergoing spine surgery, we will be dependent on the persons at home. We won't be able to ambulate or mobilize independently, which is again wrong. What nowadays we are doing is that once the patient undergoes spine surgery, he or she will be mobilized the second or third day, depending upon the wound status and the operative wound status of the patient. And apart from that, from the second day itself, we make the patient sit and we advise the patient physiotherapy with the help of our trained physiotherapists here at Medicover Hospitals, and the patient gets discharged by either third or fourth day. So again, this is a wrong idea in people's mind that if you undergo spine surgery, you will have to be dependent on patients. So here at Medicover Hospitals, we as a group are trained doctors and nurses who tend to manage patients with all kinds of spinal disorders, starting from pediatric to degenerative, with the best possible care at global standards. Thank you.